Dear friends, welcome to this session of Outpace Parkinson's program. In this session, I will take you through Parkinson's disease and will update you about it.
Back to the Future was a film that helped define the 1980s and made Michael J. Fox a star. More hit movies followed, as did a string of awards for his TV series like Spin City. Now, though, his future's increasingly defined by Parkinson's disease.
As soon as I wake up, I can't go back to sleep. I mean, it starts going. So I would say that's the toughest part in the morning is to kind of go, well, I'm up whether I like it or not, I'm up now. And the other thing that happens to me in the morning, first thing is I get that dystonia, which is kind of cramping, and it can be very extreme.
In a rare interview on ABC, he spoke about the new challenges from something as simple as using a toothbrush.
Sometimes I have to put the brush down on the countertop, hold it flat, and get the bristles on, because if I hold it, I'll miss it. It's a moving target. But then once I get all loaded up, then I just kind of bring it up to my mouth and then just let it go.
Remarkably, he also revealed that ice skating appears to temporarily block his symptoms, but only while he keeps moving. There's no cure for Parkinson's, but Michael J. Fox has been fighting to change that. He's gone from actor to activist, campaigning for politicians backing stem cell research, which might offer hope to Parkinson's sufferers. Millions have seen the powerful TV campaign he made a few years ago.
They say all politics is local, but it's not always the case. What you do in Missouri matters to millions of Americans. Americans like me.
Michael J. Fox returns to ABC with an
He devotes much of his life now to raising awareness about Parkinson's. And after many years off the big screen, he says he still watches his old life on the small screen.
At any given moment, I can flick through the channel and see myself. And for a long time, it was just like I stumbled on an infomercial or something and just keep clicking. But now, every now and then, I will stop and watch it a little bit, and I'll just enjoy it. I'll just enjoy it for what it is and the time it was in my life. And I don't have any... There's no wistfulness in it. There's no longing.
Richard Lister, BBC News, Washington.
So friends, we have just looked through this video of Michael J. Fox, and we all know that he was a great Hollywood actor and then suffered from Parkinson's disease at a very young age. And now he's an activist who talks about Parkinson's disease. He is helping with the research, and he funds a lot of research all over the world about Parkinson's disease. And he is giving his own account about Parkinson's disease and how he's being affected by it. So if we talk about the earliest evidence when the Parkinson's disease was known to us, comes through ancient Indian medical system known as Ayurveda, as long as 4,500 years back. At that time, Parkinson's disease in these books was written as Kampavat. Kampa means shaking, and Vata means lack of muscular movement, which is considered to a Vata disorder in Ayurveda. The Mucuna pruriens plant was used in ancient times to treat the symptoms and was later discovered to contain levodopa. So that was also a very early discovery that a plant known as Mucuna pruriens, which can help with Parkinson's disease, and now we know why, because it has levodopa. The earliest account in India concerning Parkinson's symptoms was compiled by Sushruta. He was an Indian surgeon in 600 BC, and he wrote a treatise known as Sushruta Samhita. He described the slowness, echinacea, and he used Sanskrit terms for them. Regarding etiology, he thought there might be some poison, and he called that poison as Kalakuta Visha and Mushtaka, which may generate rigidity and tremor. And he also called all the different types of symptoms by Sanskrit names like tremor, rigidity, bradykinesia, walking problem, imbalance, cognitive issues, sleep disturbance, and depression. So he very well categorized Parkinson's into motor and non-motor symptoms and wrote a good treatise. Now, in Western medical literature, the first account of Parkinson's disease comes back around 175 AD from the famous physician Galen. He described Parkinson's disease as shaking palsy. In 1817, the physician from England called James Parkinson, published a very detailed description of the condition. And so Parkinson's disease is known by his surname. So if you see through this chronology of the orders, James Parkinson was born on 11th of April 1755. And now we celebrate this day as World Parkinson's Day. In 1817, he wrote the treatise known as An Essay on the Shaking Palsy. And since then, we call it Parkinson's disease. So it's almost 200 years, more than 200 years since he wrote this treatise. And still, we are not close to any cure for it. Now, looking through the epidemiology of Parkinson's disease, it occurs to about 1% of people more than 65 years of age. And the disease affects around 10 million people worldwide. In Australia, there are around 80,000 people affected by Parkinson's disease. At least 32 Australians are diagnosed with the disease every day. 20% of sufferers are less than 50 years of age, and 10% are diagnosed before the age of 40. Then who gets affected by Parkinson's disease? It is one of the most common brain conditions in Australia. Anyone can get affected by it, men and women, and now we have known that it's not just the disease of old age, even young people can get affected. Definitely it's not contagious like infections. You cannot catch it or pass it on to someone else. But yes, there are some cases in which it is found that there is a hereditary lineage to it, but not in most of the cases. Now, when we come to the causes of Parkinson's disease, I should say that we still don't know. But then there are so many things which are implicated to cause Parkinson's disease. So we can call it a multifactorial disease. That means it's not the same cause in everyone. So there can be environmental causes like different toxins. It could be different type of food. It could be genetics, or it could be some sort of an infection which might have triggered the disease. Or it could be multiple factors altogether. So the toxins like MPTP induced Parkinsonism was diagnosed in narcotic addicts in US. And that helped us to form a model to study Parkinson's disease. Now, other chemicals similar to MPTP like paraquat, diquat, isoquinolines have been found to cause Parkinson's disease. Mitochondrial toxins like carbon monoxide, cyanide, heavy metals like manganese can lead to it. Organochlorine, insecticides. Even in animal models of Parkinson's disease, we use a pesticide known as rotenone to mimic the disease. So definitely various toxins in environment can cause Parkinson's disease. What are the lifestyle factors which can affect or which can make one prone to Parkinson's disease? Coffee has found to have an inverse relationship. That means it's protective. We don't know how. Cigarette smoking again has an inverse relationship. It's being shown that people who smoke probably get some sort of protection for Parkinson's disease. But it doesn't mean that you should start smoking if you've got Parkinson's disease. In studies, they have found that people who still keep smoking, when they get Parkinson's disease, actually they make their Parkinson's disease worse. Alcohol has no clear relationship with Parkinson's disease. Diets like animal fat, dairy products, high iron diet are also being implicated to make you more prone for Parkinson's disease. Non-steroidal anti-inflammatory drugs have found an inverse relationship. Head trauma can lead to Parkinson's disease, and it's being seen that people who are in contact sports like boxing can develop Parkinson's disease, as probably happened in case of the famous boxer Muhammad Ali. Infections, we are not clear. There is also a theory that it could be a prion disease, which is a proteinaceous infectious particle. But we are not sure about this. What are the risk factors for Parkinson's disease? Old age is definitely a risk factor. There are more chances of getting Parkinson's disease as we grow old. At 50 years, there are less than 10 cases in 100,000 of people, while if you are more than 80 years of age, the chances are 200 among 100,000 cases. Males are more prone. The ratio is around 1.5 male to 1 female. And we have already talked about the genetic risk factors, environmental risk factors, even the where you live, rural living, gardening, pesticide, use of well water drinking, all are implicated in epidemiological studies to make you more prone to Parkinson's disease. Occupational exposure to heavy metals like lead, copper, manganese, iron can be one factor. Let's talk about the pathology of Parkinson's disease. If you see in this diagram, on the left hand side is the normal brain. It is the section of the midbrain, and you can see the black area in the middle of the midbrain in a form of a line. This is where the dopamine is being produced. This area is known as substantia nigra. And when you see in a Parkinson's disease autopsy brain, this area is not that heavily pigmented. And this is because there is no dopaminergic neurons. And in the slides below, you can see there are dopaminergic neurons here on the left-hand side in a normal brain, and they are very scarce in a Parkinson's disease brain. So there is loss of at least 80% of dopaminergic neurons when you have the first motor manifestation of Parkinson's disease in form of slowness or in form of a tremor. The below figure is pathognomic of Parkinson's disease. We call them Lewy bodies. And so this is being found in the brain and even in other parts in Parkinson's disease. This diagram shows how the disease manifests and how the disease moves. So there is a pre-symptomatic phase and then there is a symptomatic phase. So the disease gradually advances upward into the brain from the lower part of the brain, from the brainstem, and goes up to the cerebral cortex. As you can see in this flow chart, the disease starting from lower part, spreading, and involving the upper part. As it starts from the lower part, you have loss of olfaction, you lose sensory smell, and as the disease advances, in advanced disease, people can have cognitive issues, memory issues, which occurs when the cerebral cortex is involved. The disease affects in various symptoms and varies from person to person. You can remember it by 3 S. It can cause shakes, stiffness, or slowness. Shakes is the resting tremor in the hand. This tremor is different from the tremor which we see in patients with benign essential tremor, in which when they hold a cup of coffee, it starts shaking. When they do some activity, it shakes. But in Parkinson's disease, someone who is sitting and the hand in the lap and the hand can start shaking. It's called as rest tremor. We call it a pill rolling tremor because most of the time it's like the thumb rubs to the index finger, like if you are doing a pill rolling, which was done in the past when the pharmacists used to make pills with the hands. And the rigidity. Rigidity means the stiffness of the body. The joints feels heavy and stiff, and that actually gives rise to the feeling that the joint is weaker. Bradykinesia, which means slowness of the movements. So the slow movements of the hand, leg, even other movements also go slow in the body, like the gut motility slows down, the thinking slows down. So we call it bradykinesia, slowness of the movements. Then there are other symptoms which are very non-specific, which means they're not specific for Parkinson's disease. And sometimes people can have in other diseases and without any disease. For an example, loss of sense of smell. This can be a very early symptom, even 10 years before patient can have their motor symptoms like tremors or slowness. A personality change, maybe it is that type of personality which is more prone to Parkinson's disease, or if Parkinson's disease leads to a personality which looks more introverted and inflexible. People can have depression as the first symptom of Parkinson's disease. Generalized feeling of weakness, fatigue can be there, muscle aches, limb paresthesias, problem in doing multitasking. Constipation can be a very early symptom, even 10 years before the other symptoms. Sleep disorders. Sleep disorders can come before other symptoms of Parkinson's disease. For an example, like REM behavior disorder, people can enact in their dreams. And the other symptom can be restless leg syndrome. They have an urge to move their legs, legs feel crampy and they feel pain in the legs, and that only improves once they start moving their legs. We see it is quite a common symptom in 8 to 21% of people. So we can say that REM behavior disorder or restless leg syndrome can be pre-Parkinsonian states. Some patients with Parkinson's can have increased daytime sleepiness. This can be because of Parkinson's disease, because of the treatment, and sometimes because they don't have a good sleep at night. They can have nightmares and they can have a disturbed sleep at night, which we call insomnia. In the later stages of disease, people can have balance issues and falls. More likely, it is something else if someone is coming with the first symptom of postural instability, balance issues, and falls. It could be something similar to Parkinson's disease like progressive supranuclear palsy, multisystem atrophy, or striatonigral degeneration. So it's very important to have the right diagnosis. Dementia comes again quite late in advanced disease in Parkinson's disease. But if it comes early, then one should think about disorders like Lewy body dementia or coexisting Alzheimer's disease. Now we'll go through this video of a patient with Parkinson's disease. And you can see he's having tremors across both hands, a bit more on the left than right. So that means the disease has affected both sides. And on his walking, you can see the left hand is not moving much. And he's also dragging his left leg. And it's more like a pill rolling tremor, you can see. Do it with the other hand, left hand. So the left hand is much slower. Yeah. And on finger tap, you can see how slow the left hand movement is on finger tapping. Now can you tap your right foot as high and as fast as possible? And the left? You can see how difficult it is for him even to lift the foot.
The message doesn't go.
The message doesn't go? Okay. Now, Lynette, you were diagnosed with Parkinson's disease about 1.5 years ago, isn't it?
Yes.
And how do you think it's going?
I think I'm coping with it quite well.
Okay.
I don't seem to be shaky as much.
Yep. And you can see the decreased
now,
facial expression.
How much Cinemet are you on?
1.5 tablets 3 times a day.
Mm-hmm. Okay.
You can see a bit of tremor across her left hand. And on finger tapping again on the left hand, she has decreased.
Okay. Now can you just play a
amplitude.
piano? Just keep your hand straight and try to wiggle your fingers as
So there's slowness of movements of the
fast
left
as
hand.
you can. Are you right-handed?
Yes, I'm right-handed.
Okay. And the Parkinson's
That's on my left side.
left side, yep.
And you can see the shaking of the left foot as well.
Mm-hmm.
And these movements get worse when you are more conscious about it, especially when you are in
right?
front of someone.
Yeah, a bit slower on the left, yep. Yeah, turn around.
Again, you can notice a tremor on the left hand
Stand
on
there.
walking. Now, everyone is affected differently in Parkinson's disease, so you can't compare yourself with others. And Parkinson's does not decrease your lifespan. It does not cause death. People can continue to enjoy a long and productive life in spite of Parkinson's disease. It takes many years for symptoms to progress to a point where they cause major problems. When they do, most of them can be managed with treatment and support. So there's nothing to get disheartened with the diagnosis of Parkinson's disease. With the right frame of mind, with ongoing medication support and changes in lifestyle, we can definitely manage it well. And how is it diagnosed? That's the important thing. It could be difficult to diagnose in early disease as symptoms can be very subtle, and sometimes it can take a couple of years before you are being diagnosed rightly. There is no one test or procedure that can identify Parkinson's disease. So the best person to diagnose is a specialist like neurologist. Some of the neurologists are especially trained in Parkinson's disease, known as movement disorder specialist or Parkinson's disease specialist. So the diagnosis is mainly clinical. There is no blood test or pathological test by which you diagnose it. So if someone is having a shake or a tremor, that doesn't mean he has got Parkinson's disease. There are other conditions which looks similar to Parkinson's disease. For an example, benign essential tremor, which we also call as familial tremor. In this, the tremor is present on action, like holding a cup of coffee, using cutlery, or holding a brush, it might shake. And this could be just a benign condition. It's not going to cause slowness of the movements. So to exactly know whether you have got Parkinson's disease or not, it's good to consult your GP and to be referred to a neurologist or a movement disorder specialist. Now there is one test which can help in diagnosis of Parkinson's disease. In Australia, it's still used as a research tool. This is the dopamine transporter imaging. We call it a DAT scan. In this figure, you can see in a normal patient, there is a lightening up of the basal ganglia, and it's quite bright. While you can see in the DAT scan of a patient with Parkinson's syndrome, how less this scan shows this area. Unfortunately, we still don't have a biomarker which can definitely identify Parkinson's disease. We all as neurologists and researchers are looking to go more in depth to understand it. And this was our attempt to find if a simple technique can help us to diagnose Parkinson's disease early.
Indicating if someone has the disease even before physical symptoms develop. Medical reporter Emily Rice says the assessment is remarkably simple and effective.
When 67-year-old Peter Honey's hands started relentlessly shaking 20 years ago, he was eventually diagnosed with Parkinson's disease.
You know something's wrong, but you're not sure what it is.
Partner Elsie Menon, who he met at a yoga class, also endured countless medical appointments before her diagnosis.
For me to accept Parkinson's was a bit hard. I thought that was the end of my life.
While Parkinson's is the most common neurological disorder after dementia, there is no diagnostic test for it. So many people suffer unknowingly for years before symptoms are recognised and treatment begins.
By the time patients start having tremors or the shakes or stiffness, slowness of movements, 80% of the brain cells have already died.
Now, RMIT University and Dandenong neurology experts have developed a new screening tool to help indicate early on if someone has Parkinson's. Patients are instructed to draw a spiral, which is analysed by specially developed software.
What we're looking for is the way they draw the spiral, the speed, the pressure.
A loss of dexterity is one early indicator of the condition.
There is where the difference between a person with Parkinson's disease and the person without Parkinson's disease is.
Another advantage of this spiral test is it's not language dependent, meaning it can be rolled out worldwide and the results won't get lost in translation. The test is proving 93% accurate, but more refinements are needed before it becomes routine. And when it comes to living with Parkinson's, knowledge is power.
If I can control the Parkinson's, the rest of my life seems to fall into place pretty well.
Being positive is the best thing for me.
Emily Rice, 9 News.
So friends, let's take a break, and in next session we will be talking about the treatment and management part of Parkinson's disease.